Hello, and welcome to Back to the Science. I'm Dr. Susan Oliver, and I'm a scientist, and this is Cindy Oliver, and she's a dog. Well, it looks like Dr. John Campbell has found yet another excuse to bang on about the joys of natural immunity and continue to fill his coffers. This time it's in relation to a text message that was sent out by the NHS about the autumn COVID vaccine program. And for you guys who live in America, autumn is what you call fall. Now, before we get on to what John has to say about this, I would just like to provide some context about the autumn program. COVID vaccines are not being offered to everyone. They are specifically being offered to people aged 65 and over, residents in care homes for older people, anyone aged 6 months and over in a clinical risk group, and health and social care staff. In other words, the people who are most vulnerable from COVID-19. And the reason it is being offered to these vulnerable people is because we know from data from last year's autumn booster campaign that an additional vaccine dose will decrease hospitalisations in those who are vulnerable. This study looked at the 2022 autumn booster campaign in England, which was done with the bivalent booster. And what they found was getting a bivalent booster provided additional protection against hospitalisation and hospitalisation requiring supplemental oxygen, ICU admission, or mechanical ventilation among people over 50 years. So, unless you're an asshole, you would want these vulnerable people to get their autumn vaccine and minimise their chances of hospitalisation. Enter Dr. Campbell.
That's why I was rather surprised to get this text, or a friend of mine got this text from the health service this morning. So a friend of mine got this as a text message this morning inviting them for further booster vaccination. COVID-19 vaccination has a proven safety record. It gives you better protection than any immunity gained from a previous infection. Let me read that bit again. This is from the NHS. It gives you better protection than any immunity gained from a previous infection. Wow. COVID-19 spreads more easily in winter. Even if you've been vaccinated before, it's important you get protection. The protection you need because viruses change and protection fades over time. An official NHS communication signed by an NHS doctor. So here we have the NHS officially saying that COVID vaccines give better protection than natural immunity. Now, if they're giving out messages like this, perhaps this is going to reduce trust in the communication from the health service. It gives you better protection than any immunity gained from previous infection. Wow.
I doubt very much that text would reduce trust in the NHS, but John's video about it probably could. And if people listen to his nonsense, it could easily result in increased hospitalisations for the vulnerable. Context matters, and it should be clear that the NHS means that getting vaccinated after being infected improves your protection. They probably could have worded it better, but it's a text, not a manuscript. And they didn't count on a grifter using it to create outrage amongst his anti-vax audience. But let's look at whether it makes sense to get vaccinated even if you have been infected. That question was answered in this systematic review, which compared the effectiveness of a previous infection with hybrid immunity against both reinfection and severe disease. This table here compares infection plus various numbers of vaccine doses against just infection. And as you can see, in every case, additional vaccination improves your protection against hospitalisation or severe disease and any infection. And if we look at previous infection plus first booster dose, we see that provides 80.1% protection against hospitalisation or severe disease compared with just previous infection. Most people would want vulnerable people to get this extra protection and will not try to undermine this important message. Most people. Some people, though, would see this as an opportunity to go off half cocked and instead regurgitate tired natural immunity talking points. And just as an aside, I almost didn't use the term half cocked because I thought it referred to attempting intercourse with a semi erect penis, and I thought that might be a bit risque for the channel. But apparently, it's got nothing to do with that. So it's all right to say it.
So this is from the WHO themselves. Following infection, 90 to 99% of infected people develop neutralising antibodies. Yeah, fair enough. Immune response remains robust and protective against infection for at least 6 to 8 months. So robust protection for at least 6 to 8 months, but the studies only went up to 8 months. So we can assume it goes on for longer than that.
It's curious that John alternates between bagging the WHO when they say something that he disagrees with and quoting them when they say something that he does agree with, although in this case he is selectively quoting them. The document that he is quoting from also contains the following information. The level of protection against reinfection, as assessed by PCR positivity, was estimated to be 50% in people aged over 65 years old. Not exactly impressive protection in this age group. And remember, the autumn vaccine program is only for selected groups of people, like those over 65. John also failed to mention that he's quoting from a document from May 2021, and the information is no longer valid. This systematic review and meta-analysis looked at past SARS-CoV-2 infection protection against reinfection and was published in 2023. So it's a bit more up to date than the WHO report from 2021. And what they found was, although protection against infection and symptomatic disease was between 80 and 90% for older variants, for Omicron, the protection against reinfection was only 45.3%, and the protection against symptomatic disease was only 44%. Protection against severe disease fared better at 81.9%, but of course, there will be some survivorship bias there, as a lot of people who got serious disease the first time around didn't survive.
Now, this next evidence I'm giving here is from Oxford Academic, Journal of Clinical Infectious Diseases. We have looked at this before. This is the paper here. Data comes mostly from Israel. Severe acute respiratory syndrome, coronavirus 2, natural acquired immunity versus vaccine immunity. So they talk about waning protection after 2 doses of Pfizer vaccine, begin shortly after the injection, so pretty well as soon as you get it, just a week or two after you get it, the immunity starts going down. But the immunity is substantially reduced after 4 months. Not really the impression the health service was giving, is it? I wouldn't have thought.
Why does John think they are offering additional doses to vulnerable people? Obviously, it's because they are not as protected as they were. So I'm not sure why he thinks this paper is saying something different than the NHS. And for those of you who don't know, waning of antibodies over time is a natural process that occurs after all vaccinations and all infections. If it didn't happen, your blood would be as thick as pea soup from all the antibodies. Anyway, this is the paper that John is quoting from. And interestingly, it provides a bit more context about this waning immunity. I'll just read it out to you. With that, evidence of waning vaccine-induced immunity against coronavirus disease 2019, COVID-19, have surfaced. Although research has demonstrated that this reduction is milder against severe disease, meaning that vaccinated individuals are more protected against severe disease than unvaccinated ones, even if a breakthrough infection after vaccination occurs. Odd that John chose not to point that out. Anyway, let's hear what else he has to say.
So they had 2 groups of people, very substantial groups. 0.67 of a million versus 662,000 people there. This large group here, vaccine not infected, SARS coronavirus 2 naive individuals who received 2-dose regime. In other words, they're only protected by the vaccine. And this other group here, they're infected but not vaccinated, so they only had natural immunity to fall back on.
Okay, so John is just wrong here. The big groups he just spoke about were the people available for the study, but they weren't all included in the study. They looked at two different models. In the first model, each group had 16,215 people. And in the second model, each group had 46,035 people. Although, to be fair to John, I don't think he is deliberately providing incorrect information in this case. He just doesn't know how to read a paper. One other thing worth noting is that very few people in this study were over 60. So the study has limited relevance to a vaccine program aimed at the vulnerable.
SARS coronavirus 2 related outcomes, and this is in times of Delta. Infection. 13 times more infection in the vaccinated group. Times 13. Incredible. 27 times more disease, symptomatic disease, in the vaccinated group. The natural immunity group getting way more protection. Hospitalisation, 8 hospitalisations in the vaccinated group. No hospitalisations in the natural infection group. Their conclusions from these authors: natural acquired immunity confers stronger protection against infection and symptomatic disease caused by the Delta variant of SARS coronavirus 2. And of course, we still are in. We were actually in Omicron times, but this was Delta. Delta was the one that made you sick, so this is probably even more important. Compared to the 2-dose vaccine-induced immunity.
Okay, so the figures that John is quoting here do actually come from the paper, but they are the Model 1 figures. The Model 2 figures aren't as impressive for natural infection, although they do still suggest that natural infection is superior. However, there is a major flaw in the methodology of the paper that means the results are totally bollocks. So what they did in this study is they compared people who had received 2 doses of vaccine prior to the 28th of February 2021, or who had a documented SARS-CoV-2 infection by the 28th of February 2021. Now, obviously, 2 doses of vaccine is not considered optimal for protection, but that's what they chose to study. Anyway, they were comparing outcomes during a follow-up period from the 1st of June to the 14th of August 2021. So at least 3 months after either vaccination or infection. So far, so good. But this is where it gets hokey. With the vaccinated group, anyone who was infected before the 1st of June 2021 was removed from the study. But with the infected group, there was no removal from the study if they were reinfected between the 28th of February and the 1st of June. What this means is people who didn't receive a vaccine after the 28th of February are being compared to people who could have had a second infection up to the 31st of May. They're comparing apples and oranges, or sugar soap and masking tape. Guess who's repainting at the moment? Anyway, it's hardly surprising that the infection rates varied between the groups when we know that antibodies always wane over time. We also know that the Israeli paper is an outlier in terms of results. Although it's not unusual for studies to suggest that natural infection is a bit better than 2 doses of vaccine for protection against reinfection, most studies show the rates following vaccination to be about twice as high as following infection, not 13 times as high like the study that John chose. And this slide just shows 2 examples of such studies. We also know that people who chose to get vaccinated generally have quite different behaviour to people who chose not to do so. And one of the differences in behaviour relates to testing for COVID. In this study, they asked people if they were likely to get a COVID test if they woke up with a sore throat. And they found that people who had 2 vaccine doses were more than twice as likely to get a test than people who were unvaccinated. So, based on this research, people in study vaccine groups would be more likely to get tested for COVID if they had symptoms than people in previously infected groups, which would skew the results in favour of the infected.
This is quite an interesting comment here from Professor Marty McCarry, Johns Hopkins based. He says that it's okay to have an incorrect scientific hypothesis, but when new data proves it wrong, you have to adapt, of course. Unfortunately, many elected leaders and public health officials have held on far too long to the hypothesis that natural immunity offers unreliable protection against COVID-19. A contention that is being rapidly debunked by science. Well, I'd say it has been fully debunked now. 16 studies have demonstrated the power of acquired immunity, and this of course means natural immunity. He goes on. That's why it's so frustrating that the Biden administration has repeatedly argued that immunity conferred by vaccines is preferable to immunity caused by natural infection. Why are they still doing this? We've seen that the natural immunity is way more protective. In my clinical experience, I have found patients to be extremely forgiving when with evolving data if you are honest and transparent with them. The incorrect hypothesis that natural immunity is unreliable has resulted in the loss of thousands of American lives, avoidable vaccine complications, and damaged the credibility of public health officials. Pretty strong words here. It would be good for our public health leaders to show humility by acknowledging that the hypothesis they repeatedly trumpeted was not only wrong, but may be harmful. Public health officials changing their position on natural immunity after so much hostility towards the idea will go a long way to rebuilding public trust.
Those of you who regularly watch Cindy and me would know that a while back we interviewed Dr. Jonathan Howard and his cat Nellie about Jonathan's book called We Want Them Infected, which details how the failed quest for herd immunity led doctors to embrace the anti-vaccine movement and blinded Americans to the threat of COVID. And I will provide a link if you'd like to purchase the book in the video's description. It's now out in both a Kindle version and an audiobook, as well as a hard copy. One of the doctors who features prominently in the book is none other than Dr. Marty McCarry. And I will just share a few of his quotes, which are covered in the book. In December 2020, when deaths were at 326,966, he said, "There's a false construct out there. There's a recommendation that we need to get every American immunised in order to get a handle on the pandemic. The reality is that 25 to 50% of Americans have already had the infection and have some natural immunity. So we may only need to get an additional 20% of the population immunised by, say, February or March to really hit those 70% herd immunity levels." In February 2021, when deaths had risen to 492,250, he said, "We'll have herd immunity by April. COVID cases have dropped 77% in 6 weeks. Experts should level with the public about the good news. There is reason to think the country is racing towards an extremely low level of infection. As more people have been infected, most of whom have mild or no symptoms, there are fewer Americans left to be infected. At the current trajectory, I expect COVID will be mostly gone by April, allowing Americans to resume normal life." Needless to say, America didn't reach herd immunity in April 2021. But that didn't stop Dr. McCarry continuing to make wrong predictions. In May 2021, when COVID deaths had reached 574,644, he said, "In February, I projected that based on the current trajectory, We'd see significant population immunity take hold in April from the combination of vaccinated and natural immunity. While most states are now witnessing the strong suppression of the epidemic today, other states will get there in May. But herd immunity is not a finish line. In that article, I maintain that coronavirus will be here for decades to come. The question is, at what point is it no longer a major health threat? For most states, it's now. As most of you would know, COVID deaths in the US are now well over 1 million. So, Dr. Makari is hardly a reliable source of information on anything related to COVID. And of course, he provides no evidence to support his opinion. As they say, claims made without evidence can be dismissed without evidence. In summary, Dr. Campbell has attempted to undermine the NHS's program to vaccinate vulnerable people with flawed, irrelevant studies and irrelevant non-experts. Let's hope the vulnerable are not sucked in by his bollocks. If you'd like to look further into the data I've presented, I provided links in the video's description. And please remember this video is about the science, but you shouldn't take it as medical advice. For that, you should speak to your medical practitioner. If you've got this far, thank you for listening. And if you've liked, shared, or commented on the video, double thank you, because that helps the algorithm and means that more people will see the video. And of course, thank you to everyone who has bought me a coffee or little Cindy here a treat. We really appreciate your support. We will be continuing to make videos about the science in the future. So if you'd like to see them, please hit the subscribe button. Thank you.